Well, the staff at Previty Clinic believe obesity and disease can be cured. CEO and president of Previty, Dr. Garrett Peel, joins us with more on weight loss options. And of course, it's important to note that you are board certified and a bariatric surgeon as well. Thanks for joining us.
Good to be here.
Absolutely. Now, one thing that I've been wondering about is, okay, you hear about the sleeve, the lap band, and there's a third, the bypass.
Yes.
What do you recommend for different people?
It really depends upon the patient
Yes.
and what they want to achieve,
Okay.
and also the comfortability of the surgery by the surgeon. Definitely obesity is a disease.
Yeah.
Patients gain weight, and that obesity leads to other medical problems: high blood pressure,
Yes.
high cholesterol, sleep apnea,
Yes.
vein problems, all kinds of things that can be cured with weight loss. Some people just need a really good diet and exercise program.
Yeah.
Some people, because of their diabetes that is not under control, or they have joint problems like arthritis, or those folks that have tried essentially the diet and the exercise routine, are not successful for one reason or the other.
Absolutely.
Some people can't exercise because they have arthritis or they have joint problems. Some people just cannot lose the weight no matter what diet they go on.
Yeah.
And that's why it's important to talk to your doctor to determine, one, if you're a candidate, and two, talk to a surgeon to see what surgery is really best.
Mm-hmm.
The data, the literature show that bariatric surgery is a wonderful option for people who cannot lose weight traditionally, whether it's through diet and exercise. The first step is to also look at the other medical problems, the diabetes, the hypertension, and that. We know that the sleeve, okay, is where we create a sleeve of the stomach, and we remove a good portion of that stomach to restrict how much people can eat. Also is a hormonal surgery, so it removes the ghrelin hormone, that hormone that makes us hungry, that says, I want food, I want it now.
Yeah.
So if we remove that hormone and we also make the stomach smaller, we can benefit the overall weight loss in a rapid way.
Yeah.
Right?
Oh, absolutely.
Now, that said, the bypass is for patients who need a lot of weight loss, probably over 100 pounds or so, and for those who are really bad diabetics. Maybe those that are on a lot of insulin, multiple medications for their diabetes. We know the literature says a bypass is probably best for patients who have probably over 100 pounds to lose, and those that have brittle diabetes. And the bypass is a little pouch we create.
Yeah.
And again, it's restrictive, but we also bypass the absorption of the food distally in the GI tract so that that fat isn't always absorbed so quickly in the duodenum and in the small bowel.
Got it. Okay.
So that helps not only with restricting how much you eat, but also how much is absorbed in the body. The band is another option. The band is a temporary option where we basically restrict the stomach. We create a small pouch of the stomach and restrict how much you can eat. You get full faster, right? Because that band goes around the stomach and it is inflated over time, and it creates, a little pouch there so that you can not eat so much. And people have had success with the band. They've had great success with the bypass and have had great success with the sleeve. It really depends upon what the patient's goals are and how those goals can be matched with your surgeon.
Okay. And of course, one thing to also point out is that, there's different recovery times for each one, or is that?
Sure. So, for example, the laparoscopic sleeve gastrectomy is a minimally invasive approach. It's done through small incisions. It's usually 1 or 2 days in the hospital, and the recovery is about a week. Okay. And then the bypass is about the same. It usually takes a little bit longer for patients because, remember, those patients are usually more obese and have more weight to lose, and so their hospital time is a little longer.
Yeah.
And then the band can be an outpatient surgery.
Oh, really? Okay.
Exactly. The band can be an outpatient surgery. However, the success rate on the band is not as good as the sleeve or the bypass. So consider that.
All right, Dr. Garrett Peel, I want to continue to explore this. We'll talk again next Thursday.
Sounds great.
Appreciate it.